So I've been having some chest pain recently. What could this be?
Oftentimes, chest pain is related to coronary artery disease or CAD. CAD develops when the major blood vessels that supply your heart with oxygen become diseased or damaged. Damage to these blood vessels can result from plaque buildup and inflammation. When the blood vessels in the heart are blocked or damaged, your muscle can be deprived of oxygen, which can lead to a heart attack or a myocardial infarction.
Am I at risk for a heart attack? If so, what are some symptoms I may have?
Modifiable risk factors for coronary artery disease include smoking, diabetes, being overweight or obese, a diet high in cholesterol, hypertension or high blood pressure. Some other risk factors that we can't control are always gender and age, as well as a family history. Symptoms of a heart attack include chest pain or pressure. Usually that's worse with physical activity and may radiate to the arm or back. It can also include sweating, increased shortness of breath, nausea, and sometimes vomiting. You may have some or all of these symptoms. Sometimes medical conditions can change the way a heart attack may present.
How will you as my healthcare providers know if I'm having a heart attack?
If you come in with chest pain, typically to an ER, the initial test you'll receive is an EKG to look at electrical activity of the heart, as well as any blood work. Certain changes in the EKG can appear initially if the heart attack is right away. You can also have an elevated measurement in your troponin, which is a blood test that's sensitive for the heart alone. That can detect damage. These tests will be performed in different intervals. Typically, the troponin measurement is followed over a period of sometimes 6 to 8 hours. If some of your lab work or your EKG looks okay and a heart attack is not suspected, then typically a stress test will be done at that point. The goal of a stress test is to exercise your heart and monitor your EKG during a period of stress. And then there's some sort of imaging that can be obtained to see if there's any impairment of blood flow in the heart.
What are the treatment options for my heart attack?
If your EKG and lab work indicate a heart attack or your stress test becomes abnormal, the next step to evaluate for heart disease will be a heart catheterization. During a heart catheterization, your cardiologist will insert a catheter into an artery, typically in the groin, sometimes the wrist, and they'll inject a contrast dye and view the artery on an x-ray screen to evaluate for any areas of blockage. Typically, if indicated, a stent will be placed to open up a blocked artery. Sometimes there's cases where there's several blocked arteries or arteries that are unable to be stented, and at that point, coronary artery bypass surgery may be indicated.
What follow-up do I need for my CAD after I've been treated?
After being diagnosed or treated for coronary artery disease, it's important to follow up with your cardiologist regularly to ensure that we can prevent any further heart attacks or heart disease. Typically, you'll have follow-up EKGs as well as blood work. They'll work on improving medical therapy for high blood pressure, for cholesterol, and for diabetes. It's important to keep in mind that any further chest pain after a heart event should be evaluated immediately, typically in the ER. What you can always work on is modifiable risk factors that include smoking, eating a diet low in fat and salt, maintaining a healthy body weight, and attempting to exercise regularly. Usually after a stent or even bypass, you'll also be enrolled in cardiac rehab.
Coronary artery disease is characterized by a buildup of plaque in the blood vessels surrounding the heart. When these blood vessels become blocked, you may suffer from a heart attack.
It is important to reduce your risks of having a heart attack by maintaining a healthy weight, eating a healthy diet, low in fat and cholesterol, and controlling any other medical conditions such as high blood pressure and diabetes. The main symptom of a heart attack is chest pain or pressure and should be evaluated right away.
Diagnosing coronary artery disease or a heart attack often includes EKG, blood work, stress testing, and heart catheterization.
Treatment may include medications, heart stents, or coronary artery bypass grafting, in addition to lifestyle modifications.
Follow up with your cardiologist is important after a diagnosis of coronary artery disease. Make sure to keep a copy of any and all testing and procedures that are done so that you can stay informed of your condition.